Newzroom Afrika visited Leratong Hospital to establish how it was dealing with the COVID-19 pandemic. And now that alcohol sales have been eased and the tobacco ban lifted, we're following up on the current conditions.
So many staff members that have tested positive, it has put quite a strain on the operations. However, we are starting to see the recoveries now, in dwindling numbers.
Psychologically, it messes up a human being. On our staffing side, we have a lack of staff members now because they have tested positive for COVID. You end up as a human being, get scared to actually test. Because I can tell you personally, I don't want to go and swab for COVID-19 because I'm worried if I get it, then I'm diminishing the staff members in my department as well.
Well, those were comments coming through from Dr. Diketseng Moloi, CEO of Leratong Hospital, as well as Dr. Nokwanda Mzondo, who is the head of Trauma and Emergency Unit at the Leratong Hospital. Now, Dr. Nokwanda Mzondo, head of Trauma and Emergency Unit at the Leratong Hospital, which services most of the West Rand, in fact, joins us to explore the state of affairs under lockdown level 2. Well, Dr. Mzondo, thank you very much for joining us here on Newzroom Afrika, in fact, once again. I mean, we just heard bites from you back in July, as well as the CEO, chatting about the impact that alcohol has had on patients, on the trauma units within the hospital. I mean, since lockdown 2 has come into effect, what are these scenarios emerging?
Good morning, and good morning to the listeners. Thank you for this morning for welcoming us. I can say to you that since the 19th of August, the level 2 lockdown, the trauma cases have actually increased compared to actually the COVID related cases. The numbers have reduced, but we're still having quite a lot of COVID cases coming through related to trauma as well. So what I can say to you is that since the 19th, let me just put it this way, for the month of August, we've seen about 558 trauma cases. Of those 558 trauma cases, 408 of them were from the 19th until the end of the month. So that should give you the numbers of our trauma cases in the month of August.
So on the back of what you're saying, Dr. Mzondo, I mean, there are a number of contributing factors that might have, caused the increase of the number of trauma cases that you're experiencing within the hospital. I mean, we've seen the alcohol and cigarette ban had been lifted. I mean, for those who draw parallels between the use of alcohol related to the increased number of cases, as a professional on the ground, as an essential worker, what are you observing on that front?
What I can say, Lizelle, is that this is a pattern for us. It has always been a pattern, even before the COVID itself, where during the festive season, January, February, March, the trauma cases will be increased. And then coming into the winter season, then it's the medical cases that increases. And then when you get back to the hot season, meaning now the springtime and summertime, then the trauma cases increases again. And what I can say to you is that some of our trauma cases, it will not be somebody coming into the hospital being drunk. Let me put it frankly that way. But it's related to somebody who was drunk who actually bumped this person. So your PVAs, your motor vehicle accidents that come in, they will be injuries that are related to somebody who bumped them, or at a level, at a certain time of early hours of the morning, which now they would be related to alcohol as well. But what I can say is that most of our trauma cases at Leratong Hospital are usually and most of the time related to the alcohol itself.
Based on what you've just said then, Dr. Mzondo, I mean, I'm just looking at the effect that it must have on the essential workers that are providing services during these times. I mean, we've seen that the number of cases are dropping significantly, as announced by the Health Minister, Dr. Zweli Mkhize. But, I mean, just on the back of what you spoke about back in July when we visited you, and perhaps the impact that it's had on you to date, as level 2 came into effect. I mean, how are you guys doing essentially?
Essentially, we are surviving. Let me just use the word survive. The psychological level that I've noticed with the staff members it's at the point where everybody just needs counseling. And I can tell you that just yesterday, I've booked most of the casualty doctors to go for counseling because I can see it has taken a toll on them, workload-wise, psychologically, because some of them obviously were infected with the COVID itself. And then there's one also of my staff members who hasn't come back to work till date because he was admitted, he was in ICU. Till date, he hasn't come back to work. But he has recovered, but he's still just psychologically not in a good state of mind. So psychologically, it is affecting all the staff members. I'm talking about the nurses, I'm talking about the doctors, I'm talking about just the support staff, the porters, and even the radiology staff, and the cleaners as well. Because to date, with the numbers of COVID even also dropping, but the fear is still there. The fear is still there. It comes with, you can see with the usage of our PPEs as well, that everybody is still fearful of this disease itself. And now with the number of traumas coming in and overpopulating our casualty space as well, it's difficult for our courtesy officers. It's difficult for our steering committee to even work because now we're still practicing this social distancing. But you can't practice social distancing in a department like the accident and emergency. And then now with all these trauma cases that are filling up the whole place, it's difficult to move around as well. So that on its own, with the COVID and the traumas, you can't do anything. You just have to just work. And I see staff members just coming to work. They just want to work and then go home. And the morale has gone down. So hence, just yesterday, I booked them for psychological assessment in different days, just to take them there, just for them to be relieved, just for them to calm down, just for them to just talk to somebody, because I can see it has taken a toll on them.
Well, it's definitely highlighted the systemic issues rife within the healthcare sector and looking at some of the long-term solutions that are on the cards for everyone along the value chain, in fact, within the sector. You know, it'll be interesting to see how the hospitals and the healthcare sector at large, what they will do to increase capacity and support to both essential workers and those who visit the hospitals at large. Again, Dr. Nokwanda Mzondo, Head of Trauma and Emergency Unit at the Leratong Hospital, chatting about the impact of Level 2 regulations on hospitals and trauma units.